All right, everyone, welcome again to another webinar by Love Your Menses and Your Health. We a conversation with Sisters Docs. I am the host, Dr. Azumah, and I'm also moderating. Today, we're going to be talking about women's health, but now we're going to be going from basically adolescence health to menopause in honor of multiple things. Last week was Menopause Awareness Week or Awareness Day. This month is Breast Cancer Awareness Month. So there's just so much awareness related to women's health. And today I have an amazing speaker, Dr. Ngozi Osuagwu, who is going to be presenting um, amazing topics for us. So we welcome you all, and we are going to quickly begin by sharing our slides. Again, this is another conversation with our amazing board certified OBGYN, Dr. Ngozi Osuagwu. Again, you guys know me, but I'm Dr. Azumah. I'm a board certified OBGYN. I'm also the co-founder of Love Your Menses and the president. Thank you. Just quickly, housekeeping by participating in this event, listening to us by way of internet, you grant us the permission to use your comments for our personal promotions. All right. All right, let me introduce quickly Dr. Ngozi. Dr. Ngozi Osuagwu is the medical director of the Women's Health Center at Doctors Hospital or Ohio Health. She's a clinical professor of obstetrics and gynecology at Ohio University Heritage College of Osteopathic Medicine. She's also part of an office-based practice in Columbus and Hillard. Dr. Swagu attended the Johns Hopkins University and received her medical training at the State University of New York at Buffalo. She's a fellow of the American College of Obstetrics and Gynecology, a diplomat of the American Board of Integrative and Holistic Medicine, and a certified menopause practitioner. Wow, that is so cool. Dr. Sagu is the author of many books, including her most recent book, Sincerely Your Gynecologist, such a good book. And which is an award-winning book. Um, it is an award-winning book, or will be an award-winning book. She also has written another book called Letters to My Sisters, Plain Truth and Straightforward Advice from a Gynecologist. Since 2015, she's been blogging weekly on women's health issues at Ngozi Oswago. MD.com. So we want to welcome you here, Dr. Ngozi. I'm going to call her Dr. Ngozi with her first name. Please pardon me, but it's the same person. Welcome, welcome, welcome.
Thank you, Dr. Azumah. Thank you very much for inviting me for Sister Docs, and it's really an honor to be here. I love your menses. It has been a great thing because I think it's important that we talk about subjects like menstrual cycles and not be afraid or ashamed of talking about it. So thank you. And I have to give a shout out to Fonchon for helping organize me and making sure that I get things on time. So thank you for having me here. As I mentioned, from adolescence to menopause. If you could put the next slide for me.
Yes.
And it is okay to call me Dr. Ngozi. That's what my blog name, that's what everybody knows me as,
Okay.
Dr. Ngozi.
Okay.
Today, as mentioned, I am an author of Sincerely Your Gynecologist. And the book is about women's health, but more importantly, it is here to help foster intergenerational conversation among women. And as you would see, the reason I chose adolescence to menopause, what we're going to talk about, human papillomavirus vaccine, you'll see that's something that we focus as a young person. As we go further, sexually transmitted infection, then contraception, abnormal uterine bleeding, genital urinary syndrome of menopause. So I'll take you through the gamut of what's common in each of those age groups. But if you would allow me to at least read the first letter in my book, because I think that would set the tone about what I think about health. And it is a sequel from my first book. So I'll start with that, and then we'll talk about these topics. I just want you to get an idea of my thought about revisiting the path to good health. And it starts out with Dear Zoe, which is the last letter from the other book, but first letter in this book. Thank you for reaching out to me. It has been 16 years since I last wrote to you about charting your own path to good health. After you reached out, I reread the letter I sent you back then. I hope the last 16 years have been good to you and you are doing well. I am still employed and do not believe I will ever go back to solo practice. It is so hard to be an obstetrician, gynecologist, and do it alone. The trend now is to have physicians employed by large healthcare systems. I'm
Wow.
fortunate I've been able to practice the way I have always wanted, putting the patients at the center. It is funny how that has become so important, but we knew about it over 16 years ago. That was one of the reasons you decided to see me at the time. I still see my patients as my sisters.
Wow.
I'm older now and realize I have to double down on self care, and would encourage all of us to do the same. We cannot take care of others without taking care of ourselves. Self care is not selfish, it is selfless. It is important to give of our healthy selves to take care of others. I still believe in having a routine. I wake up and pray each morning. The Almighty is an important part of my life. The Almighty is at my core. I then get up, scrape my tongue, brush my teeth, and exercise. There are several components of exercise: aerobic, resistance, flexibility, and balance. I make sure to incorporate each into my weekly routine. Afterwards, I meditate, then take my shower. Sometimes I meditate prior to exercising. It really depends on my mood. Meditation is definitely a must each day. Taking time each day to be present and focus on just breathing is a wonderful experience. As I mentioned to you in the last letter, breakfast is important to me. I no longer eat on the go. I sit down to eat my breakfast. I sit down to eat all my meals. I pack my lunch most of the time, except on special occasions. My dinner is in the early evening. I love my fruits and vegetables. Sleep has become extremely important to me. Everything I read emphasizes how important sleep is to maintaining good health. I have learned how to use the do not disturb setting on my phone. There is nothing that important that cannot wait until the morning. There are 5 people in my life who can bypass that setting, and they know how important it is for me to sleep. Sleeping can be difficult, especially when on call covering the physicians in my group. Babies come when they want and not between 9 a.m. and 5 p.m., as would be our preference if we had the choice. I still get those 2 a.m. deliveries, and while one day I will have to leave those deliveries to the younger physicians, today is not the day. I still love delivering babies. I have been truly blessed with a great family and know everyone is not so fortunate. For the most part, I have also benefited from having an excellent work family, and some of my best relationships are with those who are not blood relatives. Loneliness is a serious risk factor for all types of health diseases, and it is so important we develop a circle of people that have our backs. I'm happy to have the blood relatives and people like you I can call my sisters. That includes you, Dr. Azumah.
Oh,
Being part of the community through church, book clubs, sororities, the list can go on, is good for our health. Do I cheat once in a while with my routine? Of course. No one is perfect, but then I get back to my routine without judgment, not feeling guilty because I am human. Routine has been helpful. It can change depending on what I read. I make adjustments depending on what I learn. Thanks once again for reaching out to me to find out how I was doing and for encouraging me to finish this book. I hope it will not take another 16 years to correspond again.
wow. 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 Okay. I have questions, but I would let you present and then I would ask them.
Okay,
They're so good.
okay. Next slide.
Okay. Uh,
I've chosen these 5 topics because I think they're important and I'm passionate about it. So let's start out with human papillomavirus vaccine. HPV is the most common sexually transmitted infection. Most people will not have symptoms. They will clear the virus without consequences. You can prevent HPV by getting the vaccine. This is an important vaccine. And what I typically tell people is, when this is flu season, I ask people, do you want to take the flu vaccine? Some will say no because it's this and this. I don't fight it anymore. COVID vaccine, you've seen 1 million people die. I don't fight it. But when it comes to the HPV vaccine, I sit down and have a discussion because this is fascinating that we actually have a vaccine. It's the only one we have that can prevent cancer. And the World Health Organization actually believes that we can eradicate cervical cancer by 2030 because we have the tools. And one of the tools is the vaccine. The other one is cervical cancer screening. And then, of course, treating your making sure that you follow up with your pap smears if they're abnormal. The thing I want to mention is when it came out, it was initially for girls. And I'm glad people realize girls just don't get HPV. You have to be with someone to get it. And then they approved it for boys. It was approved up to age 26. And then in 2018, it got approval to age 45. And what happened, a lot of my patients now, well, nobody told me this. Well, at that time, insurance wasn't covering it. But right now, this year, all of a sudden, we have had no problems. Insurance companies are covering the HPV vaccine. I would encourage everybody 45 and younger to get the vaccine if you haven't had the vaccine. Just a note, if you get it before age 15, ideally we want to get it 11 and 12 when someone is in middle school. If you get it before 15, you only need 2 shots. If you get it 15 and above, you'll need 3 shots. You'll get 1 shot now, 2 months later, then 4 months after that. If it's before age 15, you would just get 1 shot now to 6 months later. I would encourage everyone to really think about getting that HPV vaccine. It's important. Next, sexually transmitted infection. Actually, there's an epidemic. We have an epidemic of sexually transmitted infections. The CDC estimates that 1 in 5 people in the US has a sexually transmitted infection. This is the startling thing. STIs cost the American healthcare system 16, I put million, I think it should be $1 billion. I mean, it costs a lot of money. And when we think about something we can actually prevent, I would rather have that money be used to making sure people get HPV vaccines, treating diabetes. There's so many things we can spend that money. Nearly half of all new infections occur among young people ages 15 to 24. And when I talk about sexually transmitted disease, the most common one, as I mentioned, is the HPV. And it's not me. I don't have any dogs in my
Oh, it's
background.
mine. It's
Okay.
me. It's me.
Okay. Sorry.
Let
No
me.
problem.
No, it's my
Um,
dog. Okay,
okay.
I'll mute myself.
HS. Oh, no problem. HSV2, trichomoniasis, chlamydia, gonorrhea, syphilis, HIV. All of these are sexually transmitted infections. One of the reasons I bring this up, this requires us having a discussion with your partner. And I think it's easy now because I hope everyone that's listening has a patient portal. They have access to a portal. If I were to date someone now, I would tell them, "Can I see your patient portal? You see mine." We compare each other to make sure and see whether you have any diseases or not. So right now, ask the question. If you go to the next slide, talk. How do we prevent STIs? We talk, test, treat. That is the CDC initiative, talking about it. You meet someone, have you had any STDs? Ask the question. Are you being currently treated? Do you see any lesions? We have to talk about it. We have to feel comfortable. What I tell everyone is if you're going to engage in an intimate relationship with anybody, you should feel comfortable talking to the person. But after you finish talking, before you engage in an intimate relationship, get tested. We now have ways to test people at home. You can have it as a date going to the health department. The important thing is to test oneself, and then after you get tested, if you're positive, treat. But there has to be open communication, transparency. Talk, test, treat. I also want to mention about HIV prevention, PrEP and PEP. I know PrEP is pre-exposure prophylaxis. We have a way of helping to prevent HIV. And I think a lot of the commercials, we believe that a lot of these drugs are limited to men having sex with men. But actually, there are two drugs that are available for women who have been assigned women at birth. We have the Truvada, and now we have this new medication that's an injection that you can get every other month. Or what you have to do is, oh, sorry, I'm still going there. I just want to make sure. I just want to stress the importance. If you are engaged with somebody who is positive HIV infection, and you do not have HIV, if you take PrEP, it is a way of preventing that infection. And then in terms of post-exposure prophylaxis, if, for instance, you engage in sex with someone and you find out they're HIV positive and you're not sure, you have the opportunity to take the medication within 72 hours for a whole month, a different type of medication. We have the ability to prevent HIV infection. So I would encourage everyone, please, 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 to be aware of this. And it's available for both men and women. Next slide. Contraception. We've seen a lot in the news, and I'm not here to decide who's pro-life, pro-choice. The thing is, whatever decision, the major thing is, if you want to become pregnant when you desire. So the first question is, do I want to be pregnant in the next year? If the answer is no, we have ways of preventing pregnancy. What's fortunate is when I started out in my field, it was 52 to 53% of pregnancies were unintended. Because of the options we have now, it's come down to 45%. I would like every pregnancy that occurs to be a pregnancy that was planned. And the way we do that is to take opportunity of what we have available. And we have a lot available. I can tell you have more available now than when I was a young person. The major contraceptives are the long-acting reversible contraceptives. You just have to go to your doctor and they put it in, and then you don't have to think about it. We have the intrauterine device and we have the implants. With the intrauterine devices, we have two types. We have one with hormones, one without hormones. So if you're someone who does not want to have any hormones, there is an opportunity to use this birth control. And I want to remind everyone, the IUD is not an abortifacient. There's some myths out there, misinformation that you're causing an abortion if you put an IUD. And I want to clear that. It is not. What the IUDs, what it does, it creates a hostile environment within the uterus so that the sperm doesn't even get to meet the egg for it to fertilize to implant. Not an abortifacient, it's available, you can have it. And then if you don't want any of these, obviously there's the pills, the patch, the shot. We have a lot available. And then there's condoms. And I would encourage condom use. If you're not sure about your partner, if you haven't gotten tested, is the one thing we have that can prevent sexually transmitted disease. And I would also say I encourage people not to engage in sex in the dark in the beginning. I think you should everyone should inspect themselves and make sure that you are happy with what you see. And if you're unsure, then you hold off and wait till you see a healthcare provider to make sure everything is clear. Again, when you're in a relationship with somebody, you should feel comfortable to have this discussion. We want all pregnancies to be planned. So I would recommend asking that question of yourself. Do I want to be pregnant next year? And if the answer is no, these are the things that I do. If the answer is yes, then I want to use this opportunity to remind people to be on vitamins that have folic acid, because that can decrease your risk of problems with the spine of the baby, getting that folic acid in. Next slide. Abnormal uterine bleeding. I This is important. It's important to know when your bleeding is normal, and this is when loving your menses is important, because I know part of the menstrual cycle is understanding what is normal for you. Usually, average age of starting your menstrual cycles at 11, and then your body has to get mature where your brain is talking to your ovaries. Then finally, you bleed, and that can take about 5 years for everything to become regular. And then, of course, it's regular, and then you have that period of time, perimenopause, where your periods become irregular. So it could be very confusing what is abnormal, but I would encourage you to talk to your healthcare provider. Normal menstrual cycle is typically a cycle that comes from the first day of one period to the first day of the next, every 21 to about 35 days. It usually should last up to 7 days or less, so 2 days, 3 days, but seven. And you shouldn't reach a point where it's creating accidents, because that's also a sign that, hey, if you can't leave the house, if you're constantly changing the clothes, then at least talk to a practitioner so that we can make sure that this is normal for you. One of the things that I mentioned is, for breast cancer, we have a mammogram that helps us to screen for breast cancer. For cervical cancer, we have a pap smear to help us screen for cervical cancer. For colon cancer, we have the colonoscopy and the Cologuard. For endometrial cancer, we don't have a screening test. The only screening test is you as the individual telling us, my bleeding is abnormal. So what is an abnormal uterine bleeding? It's when you've gone a full year without a bleeding. So usually, the way we define menopause, postmenopause, is when you've gone a full year without bleeding and then you start to bleed. That's abnormal. But if your bleeding is lasting more than 8 days, that is abnormal. If your bleeding is coming more often than every 21 days, that is something we need to know. And for young people, I would say anybody younger than 45, 40, if you've missed your period for at least 3 months, and for instance, if you're 20, you've missed your period for 3 months, you should also have that checked out. You might say, oh my God, it's wonderful, I don't have a period. But we want to make sure that everything is okay, because unless you are going to a physician and we're giving you hormones to help prevent your period when you're young, if this has happened naturally, we need to know, because that can also be a sign of something going wrong. Again, feel free to talk to your practitioner. Let us be the one to determine if this is normal for you. Also, I just want to mention, I don't want you to freak out and think, oh my God, my bleeding's abnormal, it's going to be endometrial cancer. Majority of the time it's not, but that's the worst thing we don't want to miss. So it's important for you to seek help. Next slide. I put this here because, just a reminder, there are various reasons for abnormal uterine bleeding. We have structural, we have non-structural. So again, it's not always cancer. It could be polyps causing it. Adenomyosis is where you have the cells that are in the lining of the uterus. It's found in the muscle of the uterus. We have fibroids. Fibroids are very common. And I want to use this time to tell you, if you are bleeding heavily, where you are soiling your clothing, the first thing we want to make sure is, does this person have fibroids? We want to rule that out. And then, of course, cancer. So the first thing your doctor is going to do after getting a history, they will order an ultrasound, and the ultrasound will tell us if you have any structural problem that's causing your abnormal bleeding. And if your ultrasound is completely normal, then we will look at the non-structural. We'll see if there's a clotting problem. As a matter of fact, a lot of young people who are having heavy bleeding, majority of the time it is a clot. It could be a clotting problem, and that has to be investigated. Is there something wrong with you ovulating normally? So people with polycystic ovarian syndrome, if you've heard that, you need to take a look at that. Is there something wrong in the lining of the uterus? Sometimes it's because of us. We cause the problem. Sometimes, for instance, if you're using the implant for birth control, one of the common symptoms is irregular, unpredictable bleeding. And then there are times we just don't know. But again, the important thing is coming to your physician or your healthcare practitioner to be evaluated. And then genital urinary syndrome of menopause. So you can see I've gone through talking about the HPV, and now we're all the way to genital urinary syndrome of menopause. I often start this topic by saying, I have it. 65% of women will have genital urinary syndrome of menopause. It is nothing to be embarrassed. It has to do with our, our, our vagina, our vulva, bladder, all of this getting thinned out. And why I say a lot of people are sitting there with vaginal dryness, irritation, going to the bathroom a lot, dryness, pain. And this is a topic we don't talk about. We feel very comfortable talking about hot flushes. But when it comes to our vulva, we don't feel comfortable talking about this. So one of the reasons I wrote Sincerely Your Gynecologist, I want us to start talking. By talking, we get to learn from each other. I am not embarrassed because I joined the 65% of the people who have genital urinary syndrome of menopause, and you should not have to suffer. We have ways to take care of this. Next slide. And one of the ways we can do vaginal pelvic floor activity. We are very comfortable talking about physical therapy, but I wanted to make sure that you know that we have pelvic floor therapy, which is you could go for physical therapy for the pelvic floor to help. We have non-hormonal over-the-counter medications that can be helpful. Also, using something like vegetable oil. And here, I always tell everybody when I suggest vegetable oil or coconut oil, please separate the two. Though I would hate to come to your kitchen and see that you're using the vegetable oil that you're supposed to be cooking to have that. So I would encourage everyone to separate, put it in a little bottle, put it in their bathroom. There's also low-dose vaginal estrogen therapy. And a lot of us confuse the low-dose vaginal estrogen therapy with the estrogen therapy we'll be taking by mouth to help with hot flushes. This therapy is very, very low dose and has not been shown to have the side effects that one is concerned about when we talk about, is it possible to have clots or possible to have breast cancer or stroke? This is very, very low dose that's really just used in the vaginal area. There's also DHEA, which is also a hormone. It's like an ovule you put in your vagina and it converts in your vagina to estrogen and testosterone. There's this oral ospemifene, which is a selective estrogen receptor. And then there's laser therapy. But before we go even to laser therapy, which some of you might have heard, that could be very, very expensive. So we have a lot of options to use. My take-home message is you do not have to suffer in silence. Next slide. As again, we've talked about the HPV vaccine. We've talked about sexually transmitted infection, contraception, abnormal uterine bleeding, genital urinary syndrome of menopause. This is all very important. I find that we're comfortable talking about how do we prepare ourselves financially for retirement. But the reason this is brought up is how do we prepare ourselves when we're retired to be as healthy and comfortable as possible? And we do this by, again, communication. And I know we're going to have a lot more time to talk and answer some questions. Next slide. I have my contact information, and I just want to read one more poem from the book because and then spend time answering all the questions that one might have. Looking in the mirror. I looked in the mirror the other day and I saw this woman, this beautiful woman, and I wondered why I had never seen her before. I wonder why it never occurred to me that she had a reason for living. I wonder why it never occurred to me that she didn't have someone define her. She didn't need to have someone define her. I wonder where she had been all this time. Yes, I looked in the mirror the other day, and oh my God, I saw her. I saw someone who needed to be here, someone who was meant to be. I like to end usually my talk with this poem because it's just a reminder that we all have a purpose here. And I know that sometimes when we're going through all our health issues, we ask ourselves why. And it's just a reminder we're here for a reason and we need to embrace ourselves, be happy with the person we are, and know that most things we can fix and we can get ourselves together to be healthy. And I wanted to give enough time to answer questions. I could talk more. I could talk more about topics, but those are my 5 topics I wanted to hit and make sure that you get some nugget out of that, the information. I can't hear you, Dr. Azumah.
Thank you. Thank you so much for this lecture and just brilliantly taking us through the journey from adolescence to menopause. And it was so beautiful. Even as a board certified gynecologist as well, it just touched my soul. It was just beautiful reviewing everything. As we begin our conversation, again, people at home viewing, post your questions and we will try to answer them. So we're going to go from the HPV vaccine. What are your thoughts? Let's say someone already has had an abnormal pap smear, so positive HPV. Should they still get the HPV vaccine?
Yes, because there are several HPVs. Okay, it's not just one, and it's better to get the vaccine because we can't define which one caused that abnormality. So you can still get the HPV whether you've been exposed. Ideally, that's why we'd like to give that vaccine starting at age 11 to 12. But being exposed to HPV, having an abnormal pap smear, even going through and having a loop electrosurgical procedure, you are still a candidate. Even you're more of a candidate because we're hoping that we can prevent further HPV or the other types from occurring. Thank you for that question.
Okay.
So yes,
You
I want you to get it. Doesn't matter if you've been exposed.
Awesome. Thank you. I don't know if you're aware of this, and I'm not trying to put you on the spot, but I recently learned that World Health Organization said one vaccine is enough to prevent HPV. Can you expand on their reasoning why one vaccine is sufficient versus, the two before age 15?
Well, first of all, you have to think about costs. The World Health Organization is really trying to see if we can eradicate cancer. So, cancer.
Uh-huh.
Cost is a major issue, but the studies have shown that one vaccine might be helpful. The United States is not ready to move towards that, so we need more studies, but the preliminary studies have shown that it's better than nothing. So one vaccine can be helpful. And what's interesting, for instance, and I don't, I sell I'm not selling, but are there side effects? So I'll give you an example. My daughter, I have 3 children. Two of my kids had no problem. One of my daughters had a problem. She got an allergy, like she just had an allergic reaction, hand swelling. And when we called the manufacturers, they told us not to get another vaccine. I'm
Okay.
hoping that that's enough for her. And some of the preliminary studies have shown that that might be enough. But I've warned her that anybody she engages with should be fully vaccinated.
I,
So,
I love that. That's so cool. And you said something. We have a lot of adolescents in our Love Your Menses community.
okay.
You talked about sexually transmitted illnesses and how to prevent them by having an open dialogue with your sexual partner. Can you? I mean, it's not an easy conversation. Like it really isn't, especially if someone already has had, let's say, herpes, right? So can you give us a tool or coach us how to do it? Like, because let's say they have something, and how do you even have that conversation? It's always, I'm not suggesting or supporting it, but it's always easier to be in denial.
That's correct. And what I would say is, especially when it comes to herpes, it's not the first thing you would mention when you have your first date. It's, I can't just date someone and say, oh, by the way, I have herpes. But you have to realize if you are going to enter a relationship with someone, and again, when you decide to have sex, this is an intimate relationship. So what I tell my young people is, if you're willing to expose yourself completely to this person, then you should feel comfortable having a discussion with the person. And if that person does not want to talk about it, does not want to do it, then you have to ask yourself, is this the person that I really want to engage in any type of sex with them? So that's what I usually tell my young people to do. And then I remind them to use condoms. I think it's, they're afraid to talk about it, but we as adults, trusted adults, have to remind them that this is an important conversation to have. If they come to me as a healthcare practitioner, I think all healthcare practitioner, all trusted adults need to be talking to the teenagers to say, yes, this is what you should be doing. This is important, and this is the reason why you should do it.
Okay. Thank you. Thank you for that. So the next one is the contraceptives. I mean, not to sound rude or whatnot, but there were two major contraceptives that were not listed. And one of them, natural family planning, right? Because we have some people that do not want to use one of those listed, but they're still practicing, a form of contraception, family planning. So, what's your take with natural family planning? um, and then the sequel to that is, what do you say to people that feel like, I don't want to use any hormones? Or I know you talked about Paragard, but just forget it for 1 minute. Because of weight gain, I'm scared of weight gain. What's your way of coaching them out of that mindset of like their fear of gaining weight? Thank you.
I'll answer the second question. You'll gain a lot
Okay.
more weight being pregnant. Okay, so that's how when they tell me that, I said, pregnancy, you gain weight. If
Yeah.
that's the only reason that you don't want to use it. Natural family planning or periodic abstinence, because there are going to be times that you cannot have sex when
Mhm.
you're doing that. So you have to be disciplined, but that is ideal for the person who has regular periods. So what I tell you, if you want to use that method, you have to be able to date your period at least for 3 months. Know exactly when your periods are coming. So if you're someone today you have a period, 3 months from now you have a period, 4 months, that might not be the ideal method for you because you really want to have a regular period. You also have to be in tune with your body to know your cervical mucus. I usually suggest, if you want this method to monitor your period for the next 3 months, there's some apps out there. You can talk to your physician. They can then help you decide when is the safe period to have sex. And once you understand that, along with looking at your cervical mucus, and some people even check their temperature, but I think with cervical mucus and understanding your menstrual cycle, you can use those two methods to help with doing periodic abstinence or natural family planning. But if your periods are not regular, then this is not an ideal method for you. And then in terms of weight gain, I will tell you, when the shot, for instance, is known, you might have heard it, Depo-Provera shot. I always say each 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 method has its side effect. If we had the ideal birth control, we would only have one. But when we talk about weight gain, I usually think of Depo-Provera. The shot is usually associated with weight gain. Sometimes the oral contraceptives, and they have those same ingredients in the ring, can can cause some weight gain. I would say be mindful of how often you're eating, exercise. But again, like you said, to leave Paragard is a copper IUD without hormones, that we have an option. again, the goal here is to have be pregnant when you want to be pregnant. And I think with the political climate that we're in, if you're not ready to have a child, then you really have to think about what you're doing. And the other thing is, you can be intimate without having intercourse. So there are other options where you can be intimate and still be satisfied in your relationship, and still love the person without having intercourse.
Yeah. Thank you for stating that you can have relationships without having sexual intercourse. You can practice abstinence as well. Again, this is not to push any political agenda as you've suggested. In the beginning, when you were reading the letter to Zoe, you talked about being able to exercise. And it was really impressive because you're a busy obstetrician gynecologist. How do you balance it? Like, I mean, do you exercise then for maybe like 5 minutes, or do you really exercise for 20 minutes? It's just, how can you help mothers listening and teach them how to balance things? I'm really impressed that you do all of that. I
Well,
really am.
my children are older now. When
Mm.
they were little, I will admit it's harder, but it was harder to find the time. But I truly believe everybody needs to find some time to themselves. I would wake up early in the morning and I will my children, I need 5-10 minutes. This is my 5-10 minutes. Like, I just need that. So if it's a 10-minute workout that I do, then I do it. But I also try to engage my kids in working out. If you're someone that has to go to the basketball game or to soccer, carry your sneakers. I'm walking around doing my exercise during that time. The other thing that I do is, if you, for instance, wanted to visit me and you said, Dr. Swaggle, let's talk, we're talking while walking. I have a joke. I had a friend, I hadn't spoken to her for a while. She called me and she said, let's go and talk. Let's go, and I need to talk to you about something. I said, bring your sneakers. And we did 3 miles. She was huffing and puffing. She said, I didn't know. I said, look, with you have my undivided attention. I can talk to you, but I'm exercising. So every opportunity I have, I try to incorporate that. So in the beginning, it could be just 10 minutes a day, and it doesn't have to be all 30 minutes at one time. It could be 10 minutes now, and then you wait a little bit, 10 minutes later. You can also make a decision. Since COVID, I don't think I've been in an elevator. I really try to use the steps. So great. It would be good if you could go to a gym, but I don't even like going to gym. So it's really using every opportunity that you can do to walk, to do an exercise. Walking is a good form of exercise too. You can do well with that. I love walking for a purpose. So I love when I sign up for a race that engages me into walking. And then you can also use it as a time to be with friends. If your friends, I always say everybody's in the same tribe. If you have friends who also want the opportunity to walk, instead of going out to dinner immediately, you walk and then you go to dinner. Many opportunities to incorporate that. But I wake up extra early to give myself the 30 minutes. That actually helps me. You don't want to see me when I don't exercise. My staff doesn't want to see me when I don't exercise. I get cranky.
Wow. I mean, discussing with you, you've come up with so many opportunities to exercise, and you've taken out the myth of like, oh, I need to have dedicated 1 hour to exercise. Like, you sound like an exercise coach at this point. So I don't know if you're looking for an extra source of income, but I would pay you, or people will pay you to coach them, because I've never thought of inviting a friend, go for a walk, and then go eat dinner. Like, that's so awesome. Wow. This is why
Yeah,
we do
it,
this. Go ahead.
yeah, no, it really works out well. Now, and it's funny because I have a friend recently. She called me. She said, I know. If I need to talk to you, I have to bring my sneakers, and so it's wonderful. It's good. It's great.
I love it. I love it. You know what? I think We can even create that into a logo. Bring your sneakers to work
Right.
out.
Bring
Like,
your sneakers. Okay.
yeah, it's
Now,
really
see,
actually, yeah.
if anybody has that as a logo, they heard it from us, right?
Yes, yes, bring your sneakers. It's so amazing. Wow, that's so cool. Um, did you know? I don't know if you know this, but Love Your Menses has expanded, and
Okay.
we started a program. Let's go to it. We started a program called Love Your Menopause. Did you see that?
Oh, okay. Okay.
Yeah, I mean it's so interesting because you said how sometimes people feel embarrassed when they talk about their symptoms, right? Of like their hot flashes, their vulva, vaginal dryness, whatnot. Yeah, so the community spoke to us, and that's why we decided to start it. Like people will come
Okay.
to us and say, "Please, can you Love Your Menses teach us more about menopause? Can you empower us? You know, we feel embarrassed and." After thinking about it, deliberating for a while, we decided to do it. And we
Very
decided,
good. No, it's excellent. And it takes you from adolescence all the way. The woman,
yes,
that's our journey. That's where we are. Yes. Yeah, it's
yes,
good. It's great. It's important. It's important because I think the hardest stage is the perimenopause stage. That's
yeah.
when our hormones are truly going through some roller coasters and up and down. Today we have hot flushes. The next day we're doing well. We're having our brain fog, and just understanding that it's not in your head. It's true. um, People are going through it, and just talking through what everybody, because what could be good for me might not be good for someone else. We enter this journey very differently for each person, so I think
Mhm.
it's important to have the conversation, know what's out there, but again, you don't have to suffer in silence.
Would you want to join us and teach a workshop? Like, I feel like you're so knowledgeable. Like, I feel you're so knowledgeable and you're passionate about this topic. Do you want to expand and open a branch up in Ohio? Like, we are ready for you. It's just like a perfect timing because really the perimenopausal syndrome or symptoms you've talked about is really frustrating for some people. It's just some people think like they can't get a break, right? Like they have endometriosis or painful periods, dysmenorrhea when they are adolescent, and now they are menopausal or perimenopausal and they're having these symptoms again. It's like, would I get a break? So how would you encourage them? To me, I say love your menopause, but I want to hear how I want to hear how you would encourage them when they are suffering from genital urinary syndrome of menopause.
Well, that is one of our syndrome. I tell them there's hope. That's why I always start out with I have it, because it is very uncomfortable. You can't wear pants. You hurt, and I have tried everything. Okay, and so I start out with myself and say, here are your options. I think what's happening is we're so afraid of. First of all, we have to know how that area looks. I don't like to call it down there because when
Yeah.
people say, "Oh, I have a problem down there," I start looking at the floor. Where? Use the right term.
Yes.
Use the right term. So embrace our vulva, our external genitalia, our vagina. It's part of our body,
Mhm.
and I just tell them, you don't have to suffer. We have tools to help you. We have tools, and I think that's important. I had someone that had even a fissure in the area, and they just thought, oh, this is something you're supposed to have because you're menopausal. This, believe it or not, this is the best time of your life. Like, this part of your life is truly the best time. You have finished raising your children. Yes, you might be helping your parents, but I want people to feel comfortable. This is the time you probably can even say things and it's okay. Like, you don't even have to be politically right. What are you going to do to me, right?
That's good.
And just be happy because we can't go backwards. We can't go backwards. We can't be in our 20s, right? So
Yeah.
and when people say I hate this, I'm like, what's the alternative, right? 6 feet under.
Mm.
This is where we are. So really, not only loving menopause, but loving yourself. I always, that's why I have that look in the mirror. Look in your mirror, embrace where you are, and know that we have tools to help you. There is something out there, but you have to say it because we don't read minds. Health practitioners cannot read minds. When we come in and we say, okay, you're here for an annual exam, this is what brings you here. Do you have any other concerns? I hope you're maintaining a diary and writing what's been happening to you and bring it. This is not the one. This is not when I finish examining you and I'm about to leave the door. Oh, by the way, we had all this time to talk about it. First thing I'd like everybody to do is get a journal and write your symptoms so you have it. That's helpful. And then when you come into your physician's office, be prepared to review your symptoms so that they can work with you and take care of it. And please understand, not every physician is comfortable talking about this. And if they're not, you can there's a website too. You might start to put a list of physicians who are comfortable. There's the Menopause Society that has a list of physicians who are comfortable talking about it. So if a doctor says, I'm not comfortable discussing this, I would like you to see another, be okay with that. Like, it's okay to do that. So not only do we have the genital urinary syndrome of menopause, hot flushes, you could talk about those symptoms. This is the time that we also want to make sure that we're screened for diabetes, we're screened for cholesterol, we're screened for thyroid disease. All of this is part of our journey.
Wow, I thank you. Thank you for saying that we have tools. We have tools not just during the menopause journey, but we have tools through the spectrum of a woman's reproductive cycle from the adolescent stage to postmenopausal. So thank you again, Dr. Ngozi, for being here and just gracing us with your presence. We truly appreciate you. You're just brilliant. Again, everyone, go get the book. Okay. Sincerely from your gynecologist. It's just a good read. Very well informed. I really enjoy the book. So I want to say thank you. And we're going to continue the slides with announcements. We talked about HPV vaccine. We also want to encourage people to get their COVID vaccine as well. COVID is still here. It's still an epidemic. So take precaution. There are many sites to get free COVID vaccines. We also, if you have upper respiratory infection or symptoms, please always rule out COVID. You can get COVID kit from multiple places. You can scan here and you're going to know where to go get your COVID kits. They are free. If you scan there, they will send it to your home for free. I was able to get 2 free COVID vaccine kit. And if you really are in the Boston area and you want Love Your Menses to give you some COVID vaccine kit, please send us a message. You can send us a message at info@Love Your Menses. Again, again, you can get it to your home. This is in different languages. All right. Again, this program was sponsored by Dr. Azumah Solutions. It was also sponsored by Love Your Menses. We appreciate Dr. Ngozi for being here. Stay tuned. We're going to also have another dynamic speaker for November, and we'll continue our sister doc conversation. Thank you, Dr. Ngozi. Thank you, our viewers, for tuning in and staying with us. If you have any question or concern, please reach out to us. We appreciate you. Thank you for your time. Again, I'm your host and moderator, Dr. Azumah.